our GP, but not every ailment requires seeing a doctor. You could save yourself a lot of time and trouble by visiting your local pharmacy.
As qualified healthcare professional...
That didn't help then, did it?
Put them back on. As qualified healthcare professionals, pharmacists can help with a range of health concerns. And here to explain more is pharmacist Naira Salim. Good morning to you.
Good morning.
What is a pharmacist? Tell us, what do they do?
Well, in simple terms, we are experts in medicines, and we have been first line throughout the pandemic to answer your queries as well as just dispense your medication. The whole topic of, what is the role of a pharmacist is such an important topic because there are a lot of people that are unaware of what a pharmacist actually does and how the pharmacy can actually help them. There is that stereotype that pharmacists are just, they count medication behind a counter, wearing lab coats, but really our roles have really revolutionised and changed with time. Not only are we familiar with the medication, but we do have that necessary training and qualification to manage minor illnesses and really monitor patients with long-term conditions.
We're a little bit behind the times here because in Europe, certainly in France, that's your first port of call. You go and see your pharmacist. And so people coming to see you, I'm assuming, could save themselves a lot of time if it's something a little simpler, that they could come and see you first before booking in to see the GP.
Yeah, they definitely can. There's so many minor illnesses now that, a lot of pharmacists can help you with. And just a bit more about the pharmacy role in itself is actually changing now. There are a lot of pharmacists now working in GP surgeries. So I'm currently a clinical pharmacist who works in a GP surgery in Essex. And I work alongside doctors, nurses and paramedics to help manage medication a bit more closely. And just touching on some of the minor illnesses, your community pharmacy can help you with. There's loads of different illnesses. There's sore throats, there's constipation. Anxiety has been a big rising issue throughout the pandemic as well.
Can you help with that as well?
And that's something definitely we can help with.
And so, as far as... Because you can't write a prescription, can you?
At the moment, I'm actually doing my prescription course. So, hopefully,
so some
mid-2023,
might even be able to write a prescription for you.
Exactly. Minor health clinics and actually write prescriptions for antibiotics if they're needed. And, the overuse of antibiotics is currently a really big problem. Sometimes antibiotics may not even be needed. So I would always advise to patients, if you're having a cough less than 3 weeks, always seek over-the-counter advice first before speaking to your GP.
Whenever my mum was ill, literally, whenever she was ill, she wanted antibiotics. She would go to the doctor and say, I need antibiotics, but you don't need them, do you?
You don't. Sometimes it might do more harm than good. You do have antibiotic resistance where antibiotics may not even be working against the infection. So definitely seek over-the-counter advice first.
You can also offer reassurance as well, can't you?
Definitely. You can always speak to your pharmacist in a medication review. So, the good benefits of medication reviews, it allows you to actually sit down with the pharmacist, go through your medications a bit more in detail and go through any health-related queries that the patient has.